Hello, everyone. Thank you for joining us on today's webinar, Strides of Pride. My name is Dr. Mina C. Kim, and I am a member of the ADA's Diversity and Inclusion Committee. On behalf of the ADA Diversity and Inclusion Committee and the New Dentist Committee, I am pleased to bring today's webinar, which is part of Amplifying Voices, a series of conversations on diversity and inclusion. I want to introduce the first speaker, Dr. Ann Kosh. She received both her DMD and her certificate in endodontics from the University of Pennsylvania. She is also the founder and past director of the postdoc program in endodontics and microsurgery at Harvard. Following her clinical and academic career, she has also formed her own successful technology and development company called Real World Endo. She's the holder of multiple patents and has authored more than 150 articles in her specialty. And she presents everywhere all the time, thousands and thousands of lectures. In addition to her clinical specialty, she's a strong advocate for professional women and presents at many dental and medical schools. She has also gifted a large seminar room at the University of Pennsylvania, and she's endowed a 5-year diversity inclusion program at the Harvard School of Dental Medicine. And without further ado, let's turn over the mic to Dr. Ann Kosh.
Thanks so much, Nina. And I'm just going to jump over here and we're going to try to share my screen. All right, this was me as a little kid growing up with my older brother, who was wonderful. And I had a great childhood growing up all through school. And one of the things with your trans patients, if they're truly gender dysphoric, they have a good sense of realizing that something is a little bit different when they're even like 4 or 5 years old. So from the age of 5 years old, I realized, why do I have this strange feeling that I want to be like a girl? I was lucky that I was able to compartmentalize it. It never made me dysfunctional, but I want you all to realize as practitioners, many trans people are not so lucky, and it makes them incredibly dysfunctional. I did really well in school and in athletics. I was actually skipped a year academically. And at age 14, I was the youngest starting varsity football player on Long Island. And I ended up becoming all Long Island in 2 sports. And everything was fine. I could totally control these weird feelings that I was having. Went off to college. College was fine. There's a picture when I was in college. I'm in the middle with the beard underneath the mousse. And everything was okay until after the sophomore year. And in those years, you couldn't play varsity sports as a freshman. You had to play freshman sports. So the first year in college, I played football, hockey, and baseball. And in the second year, I played varsity baseball and hockey, which was pretty amazing. And then I couldn't handle the locker room anymore. And I completely, totally walked away from collegiate athletics. And that was very tough to explain to parents, to coaches. I had many opportunities for professional baseball, for instance. How come you're just walking away? But I could not say that's because I really feel like I should be a woman. I couldn't say that in 1967 and 1968. So I just made up some kind of lame ass excuse and walked away from athletics in its entirety. So after college, went to dental school. And after dental school, I went into the Air Force, which was really fun. I went over to Japan. I was trained in prosthodontics in the Air Force, which was wonderful. But when I was in Japan, I all of a sudden kind of was discovered and worked for 4 years as a commercial actor and model. I did probably close to 40 major commercials. So I was leading a completely, totally charmed life as a guy. But never, not for 1 second did it ever go away. It's always there. I can compartmentalize it, but every day in my life, I was thinking about becoming a woman. Some days I would think about it for maybe 3 minutes. Other days I would dwell on it for 4 or 5 hours. But again, fortunately for me, it never made me dysfunctional. Now, when I think of myself in those years, this is how I see myself. And I'm very unusual in that I'm very comfortable talking about my pre-transition life. In fact, I'm actually really proud of how I conducted my life. And when I see Ken Koch here, I see this guy as being my twin brother. I'm always kind of amazed that more people don't ask me about how I feel about my pre-transition life, which was 63 years, but I'm very proud of how I conducted it. After the military, I went back to Penn for endodontic training. And then from there, I went up to Harvard. And that's really where I kind of made my reputation, which was wonderful. And I'm still very, very active with both institutions. And then I left Harvard and I ended up creating my own company. And I went all over the world. It turned out to be the biggest continuing education company in the world. And then I realized I had an ability to create products. So I was enjoying what I was doing. I was having fun. I was doing better financially than I could ever imagine. And then I got diagnosed with a squamous cell cancer. And what happens, that's very common with the older trans patients, there will be a trigger event that hits you like a ton of bricks. It's like mortality. And what you realize is that, oh my gosh, I have to transition. I cannot die being a guy or being a man. So what happened over the course of about 7 months, I lost 70 pounds. And over a year and a half, I went from this guy in front of the audience to this person. And I think that's what you call a transition. Now, what was really interesting about this is that everybody who has a transition or goes through a transition, everyone's story is different. And we need to understand that as healthcare providers. Everybody is different. Everyone is unique. We should celebrate the diversity. But I think when people see me and see how I conduct my life, they think, oh, that was probably easy. That was a piece of cake. What, are you kidding me? It was sheer terror. I had a major company have a fatwa against me for like 49 months, but who was counting? And it was just devastating how everybody avoided me. And I lost so much, not just financially, but in terms of friends and things like that. Nobody knew how to react. And I even was thinking of having a lawsuit. And then I had spent quite a bit of money with the law firm in Philadelphia, but I made a decision. And the decision was the following. It was the first time in my life I wasn't controlling the narrative. And if you're coming out and you're transitioning, you really have to control the narrative. You have to make sure people understand your story. So I decided, no, I'm not going to have a lawsuit. Yeah, I could get a couple of extra bucks from that maybe, but I'm going to reestablish myself in my specialty. So I made a commitment, and it was around 2015. Damn it, I'm going to reestablish myself. That was a huge turning point for me. The University of Pennsylvania and Harvard both were incredibly helpful for me, reaching out to me, offering support. I received such incredible emails, one from Mina's uncle, Dr. Singh-Kuk Kim. It was the most humanistic, heartfelt email I ever received in my life. And ultimately, I ended up gifting a large seminar room, the second biggest seminar room at Penn. But there's another plaque that I'm not showing you on the inside wall of that room. And what the plaque says is the following. This room has been gifted in recognition of LGBT students, residents, faculty, and staff. The bullshit has to end. Having lived my life for 63 years as a very successful heterosexual white guy, I was stunned at how many individuals I met in the LGBT community who were intimidated about coming out. Faculty members were worried about tenure. Students were worried about not matching, not getting into the residency that they really cared about. It gave me an entirely different perspective. And in the trans community these days, I see discussions that are getting too exclusionary. It should be inclusive. If you want to be accepted and be inclusive, you have to accept other people. So I love this idea about a gender being a spectrum and people finding their spot. I also think in transgender medicine, we've gotten a little bit ahead of ourselves in terms of surgical procedures and hormones. People 16 years old have to kind of find themselves. They should have room to be able to find that specific gravity that works for them. But for us as providers, everything should be patient-based, and we should offer inclusivity and support for these people. It's what I call cultural competency. I've also had fun because I have a unique perspective doing this from both genders. And I do a presentation about entrepreneurial woman doctor. I couldn't believe how much BS women have to put up with in accomplishing things. That was another thing that was illuminating for me, was not on the trans thing, but was on the challenges that genetic XX women face getting to certain positions. There's obviously been huge advancements in that in the last 2 or 3 years. One of the things I've done is I support also the transgender health program at Philadelphia College of Osteopathic Medicine. And every year I do a couple of interviews, and I hope you all recognize who's standing next to me. That's Dr. Rachel Levine. Rachel is beyond fabulous, maybe because she was also an ex-hockey player. But Rachel is the Assistant Secretary for HHS. And one of the things that is on my frequency, and I have a wonderful relationship with Rachel, is the following. When you go and you take a look at her bio on the government archives, you'll see all the accomplishments she's done, and they are many. But one word you never see anywhere in the bio is transgender. And this is one of the things. Being transgender is obviously part of her life. It's part of my life, but it does not define who I am, nor does it define who Rachel is, okay? And that's something you have to understand. And as a provider, and if this is something that you're still a little uncomfortable with, what you have to understand, it's the patient's prerogatives. In terms of pronouns, that's not your decision. That's their decision. Simply ask the patient, how would they prefer to be addressed? So if they want to be he or him, fine, she or her. If they care for Z or they, that's their choice. That's not your choice as a provider. That's their choice, and please respect it. This is the latest kind of morphed condition of me. So this is the whole thing. And so I lead my life a certain way. That works for me. That doesn't mean everybody who's transgender or transgender woman needs to live their life like me. I don't. I live my life in what I call the mainstream world. I played competitive tennis for a while, but I kind of backed away from that. But I do just about everything I did before my transition. But the one thing that the transition has allowed me is to view cultural competency through an entirely different prism. This is why I wrote my book. This book is not for young people. It's not really for gay and lesbian individuals or bi. This is meant for older transgender individuals. And it's done very well. And I've received literally dozens of emails from physicians around the world. And when I've tried to make the book, I've tried to make it patient-based. I don't care about agendas. I don't care about the far right or the far left. I surely don't care about individual agendas. But what I care about, the most important person to you as a healthcare provider, is that person sitting in front of you. And for young people, young graduates, dental graduates, medical graduates, you have to realize you have to treat the person who came out of prison 2 weeks ago the same way you treat the CEO. It's about having the honor of wearing a white coat, of being a healthcare provider, in my opinion. This is a great quote from Maureen Osborne. Many therapists in the trans world happen to be trans individuals themselves, lesbian women also. We see some gay men, but Maureen is a hockey mom. I mean, it's kind of interesting, but she's one of the greatest, most experienced therapists in that space. But what she writes here is incredibly true. And I think the thing here that's really important is that they share the struggle to be authentic, to be known, to be heard and received. It is so important. I have found in my career transgender patients to be incredibly terrific patients. If you're treating them like you treat everybody else, what happens, they all of a sudden realize, oh my God, you're terrific. And they become very loyal, wonderful patients. It's astonishing to me. I've spoken at many medical schools, how many transgender individuals have been assaulted in healthcare facilities, not just verbally assaulted, but physically assaulted. How does that happen in this country? Okay, so this is all about cultural competency, understanding the patient. And let me just mention a couple of things here about cultural competency. A few years ago, before the pandemic, I was a keynote talking on cultural competency at a kidney dialysis convention, right? I'm an endodontist, but it was a kidney dialysis. There were 428 nurses at that conference at 3 docs. The last question I received was from a young nurse, and she said the following: Dr. Koch, I'm a very religious individual, and I have a number of other nurses who feel like I do. And here's my question to you. I said, yes, what is that? She said, why do we have to treat someone if we fundamentally disagree with them? I couldn't believe that question. I thanked her for that question. That gave me 4 minutes to address what it means being a healthcare provider. And in that 4 minutes, I mentioned to this woman, if you cannot separate your personal biases and prejudices as a healthcare provider, you are in the wrong field. You should be an accountant. But if you're going to work with patients, the most important thing to you is what is in the best interest of that individual sitting across from you. And when I got done with my 4 minutes, I literally got a standing ovation from the other 427 nurses. But to me, this is so clear. What this is about in terms of diversity and inclusion, it's about an education issue. I love this picture. This was taken at Penn a number of years ago. Their LGBT group at the dental school was called Amalgam, which is very fitting. And we had a nice group, and they were all leaving. I said, wait, I need to have a picture. But what I want you to do is I want you to take a look at this picture and look at the heterogeneity. There's all kinds of people here. Look at the diversity. But most importantly of all, I want you to look at this picture and look at the humanity. That's what this is about. So I'm very, very proud tonight to be the first person going out of the gate. Because for me, what this is all about, yes, this is about educating everybody. Whether you're an assistant, a hygienist, a doc, specialist, whatever, this is education. Secondly, this is about inclusivity, not exclusivity. You know, for me, sometimes I think the biggest binary is maybe age. It's not gender, but it's age. There's such different thought processes going on. But this year is my 50th year in dentistry, counting dental school. I've seen a lot of things, a lot of water under the bridge. We have such a great opportunity at this point. We've made such advances. We can't ruin it by being confrontational. We have to enhance it by being accepting and being inclusive. And for me, all of this can be rounded up into 2 words. That's cultural competency. And that's how I feel. Okay. So I really thank everybody for giving me the time. And I think I was able to get 70 years in less than 15 minutes.
Thank you so much for sharing with us your experience and just kind of giving us the patient view as well. I think we already have like a lot of thank yous, and I'm sure we'll have a lot of questions.
So my pleasure. Thank you. Sorry for the glitch.
No, it's great. I want to go on and introduce Dr. Alex Barrera. Dr. Alex Barrera practices general dentistry at Avenue 360 Health and Wellness in Houston. Dr. Kosh, can you, I think you have to stop your screen share. So, thank you.
Yep.
And sorry. And Dr. Barrera graduated from University of Texas in Houston. He's a member of various organizations, including the American Dental Association, the Hispanic Dental Association, the Greater Houston Dental Association, and the Houston Equality Dental Network. He's the chair of the New Dentist Committee for the Hispanic Dental Association, the chair of the Communications Committee for the Greater Houston Dental Society, and he also participated in the ADA's Institute for Diversity and Leadership. He is a participant of the National Health Services Corps and alumni of the Albert Schweitzer, sorry, butchering that name, fellowship program. He is an advocate for the LGBTQ plus health and uses his platform to educate dental professionals on how to better care for the LGBTQ plus population. And without further ado, let me turn it over to Dr. Barrera.
Thank you, Dr. Kim. Hello, everyone. First of all, I just want to say Dr. Koch is one of my mentors and someone that I had the pleasure of meeting virtually about a year and a half ago during the pandemic. We had some great conversations, and she's been a huge inspiration to me and to the work that I do. So thank you, Dr. Koch. I'm going to go ahead and share my screen here, share my presentation. Okay, so I'm going to start off a little bit about myself. I am from a border town from Laredo, Texas, which is down in South Texas. My family home where I grew up was about a 15-minute car drive to Mexico. So I grew up in this sort of dual culture life. A big part of my identity growing up was my Mexican identity. And unfortunately, with that came kind of never really finding a place for myself, never really feeling American enough, but also never really feeling Mexican enough, kind of feeling somewhere in the middle. So, now looking back as an adult, that really kind of resonates to the work that I try to do today. I went to college down in Laredo. I went to Texas A&M International University. And afterwards, I came to Houston for dental school. I attended dental school at the University of Texas School of Dentistry. That's our nice, beautiful building. And this is a picture of my parents and I during my white coat ceremony. So the week right before dental school started. So it was the end of our student orientation. Everyone was nervous, excited, ready to get started, not really knowing what we're putting ourselves into. And during this white coat ceremony, I brought my partner at the time, someone that I was dating. At the end of that ceremony, I had someone from the administration, come to me or come to my parents, actually, come to my father, to advise him to tell me to not bring my partner around the dental school anymore. So that was my introduction to dental school, right? And so the first few weeks were left with a lot of confusion, a little bit of an identity crisis, really trying to figure out if I made the right decision to come to dental school, if I felt included, if I felt like I could be myself. Quickly, I met several classmates, several people that I was able to really share who I was with. And at the time I was out, I came out to my parents when I was 18. I came out to all friends and family at the time. So this wasn't anything I was really hiding. But when you're thrown into a completely new, scary setting, into the intense world that dental school is, it's a big bubble of stress and anxiety already. And to add something like this on top of it, I didn't know if I was going to be shunned from my classmates or from my peers or my colleagues or my professors because who I was. And because of this, I kind of, laid low those 4 years. And now looking back, even being out of the closet and being happy with my identity and who I was, now looking back, I see that I was still really negatively affected by all of this, because I never really felt that I could express who I was or be who I fully was in the dental world, the dental profession. And so because of that, I kind of always kind of laid low a little bit. I avoided going to speak to professors out of just fear of being discriminated against or fear of judgment. I never really created that strong bond with my professors or with the dental identity as a whole. Fast forward, a couple of years after graduating dental school, I started working at Avenue 360 here in Houston. Avenue 360 is a federally qualified health center in the Houston and greater Houston area. Our main focus as an organization is, of course, serving the underserved, but specifically serving the HIV and AIDS population of Houston. So next week will actually be 4 years that I've been working now. I've been at the same clinic since I graduated, and it's been a wonderful experience. I have some really great mentors, both dental mentors, medical mentors, people working in the healthcare administration setting that I really look up to and really am supported by. So after a couple of years of working here, I attended and participated in the Institute for Diversity in Leadership. So that's my class a couple of years ago. I guess a year and a half ago, 2 years now. And this program was very, very special to me. This program is the reason I'm here today. This program inspired me to create an organization where I felt at place and at home. Throughout dental school, I was involved in a lot of dental organizations, but still kind of really timid to take charge and take a leadership role in any way. I was timid to put myself out there because of kind of fear of discrimination or just not really feeling at place at all times. This program with the American Dental Association changed all of that completely. It really allowed me to find my own voice and find my place in this profession. And after doing this fellowship program, it was almost like a 180 with how I see myself in the world of dentistry. So this program allowed me to create an organization, a nonprofit organization here in Houston. We call it the Houston Equality Dental Network. So the Houston Equality Dental Network is a nonprofit organization aimed at focusing on LGBTQ health issues and increasing awareness on LGBTQ education topics amongst practicing dentists. but also increasing that span of education in the dental schools, not only in Houston, but eventually across the country as well. And this organization really started as something social, something where a few of us wanted, a safe space to be ourselves, but also be professionals, also talk about dentistry, and also organize as a group. And so something that started as a social organization, once we started getting together, we kind of, quickly realized our power and realized the different things that we can do together as an organization, as a group. And together, we created this organization. And since then, we have been able to speak at the dental school, host professional networking events, community service events, online webinars. And, we had a lot of things planned for 2020, like most of us did. And unfortunately, a lot of these things were changed and canceled because of the pandemic. This was kind of a little bit of a blessing in disguise, because a lot of our CE courses, our continuing education courses that we had planned, became virtual. And that allowed us to have a national platform. So that allowed, people from all over the world to participate in our webinars. And one of our values and our goals and missions as an organization is to create webinars, number one, focusing on LGBTQ health topics, to increase that awareness and education amongst practicing dentists, dental hygienists, the dental staff, but also to provide these courses for free. To also provide these courses that you don't normally see in a typical dental setting. So courses on racism, courses on trans rights, political courses, things that we can, things that we don't really see in a lot of other dental organizations. But above all, our main mission and goal was to support each other. I'm happy to say that there's an LGBTQ dental organization, student organization at the dental school here at UT now. And we're really involved with that organization. The students are really involved with our organization. And it's just so nice to see how we can bring those students in and be a support system for them throughout these 4 very difficult years. And these are just some of the flyers from some of the events we had this past year. Like I said, we've done community service events like oral cancer screenings. We've done presentations at local LGBTQ community centers. A big partner that we have is the Montrose Center here in Houston, which is our LGBTQ center in the city. We provided oral health presentations and demonstrations to a lot of the different groups that they have. Throughout the pandemic, we had to, get creative. How can we help our community? We offered free virtual dental screenings to the queer community. And that helped us help these members of the community find access to care for their dental needs. This is a picture of the group just last week, actually, less than a week ago. We had our first in-person event in over a year. And let me tell you, it was very, very special to see these people, to get together with these people. And something that has been the most beautiful thing for me to see is how a lot of our members have kind of flourished into their identity. A lot of members who, at first were a little bit iffy about being visible, about having their name on a roster, or even about coming to an event. Because unfortunately, there are a lot of people that are still in that process of coming out, or, the process of coming out is not a one-time thing. It's something that I have to do almost daily, whether it be a patient, a colleague, a friend, anyone. And it is a spectrum. It's a spectrum of different, with a different timeline for each individual. So like I said, one of the most beautiful things that I've been able to see was where our members really flourish into their identity. So here we have some of our members, as well as some of the dental students that joined us last week. And something that's very exciting is while we started as a local organization, we did that because that was something that we could control and really could see an immediate response to. And with our organization now having more of a national level, we have colleagues in Austin and Dallas who are hoping to start their own chapter of the Equality Dental Network in their respective cities. And the goal is to continue to allow this to spread. When we started HEDEN, the Houston Equality Dental Network, I did a lot of research. I did a lot of asking around, a lot of Googling to see if there's any other organizations like this. And there weren't. There's nothing that we could really find. So to have this now and to have it spread to a national level has been something very special for me to see. So I'm going to talk a little bit about how we can be a better ally as a dentist, as a straight dentist, or someone that maybe may not be a part of the community, you're familiar with the community. So first and foremost, these are 5 kind of simple, really nice, easy to read tips that we can share. You can share with your staff, with your students as well. Number 1, recognize your privilege, use it for good. So, now, especially after these past couple of years that we've had as a society, we understand privilege a lot more. And we're able to see that many different types of privileges are true and do exist. Straight privilege is a thing, and it exists. It exists because you can go and walk down the street with your lover hand in hand and not worry about getting bashed, not worried about getting discriminated against. This is a privilege because you can apply to residency programs and not worry that your sexuality is going to affect your admittance or not. So having privilege is not a bad thing, but it is important to recognize that privilege does exist and use that platform to help underserved communities or help communities like the LGBTQ community. Learn and use inclusive language. There are maybe some words, some languages that we might not be familiar with if we're not part of the queer community. It's important to know what these things are, what it means to be homosexual, what it means to be transsexual, what it means to be intersex. Things that, again, that we don't really get a lot of when we're actually in dental school. So one of my goals in my career is to start to increase that use of this language around our dental profession. Be comfortable with being uncomfortable, right? As you start to incorporate yourself more into the community, start to try to become a better ally, there may be slip-ups. You may use the incorrect pronoun. You may feel uncomfortable sometimes with someone that may not be like you, may not be part of your community. That's okay. That uncomfortable feeling, that's something that queer people have to go through daily just to navigate the regular world. It's okay to be uncomfortable, and that means you're trying, right? If you have slip-ups, that's okay. We want the effort. Be visible as an ally. So something I really recommend with colleagues, with friends, is to use your pronouns, right? And have your pronouns visible. You can see my pronouns are on my username here at the Zoom. Something as simple as that, just having them on your Zoom account, having them on your email signature, things like that, just show someone in the queer community that you are an ally, you are safe, and you are understanding. Other ways to be visible as an ally: celebrate Pride Month, celebrate Gay History Month in October. Be part of the community by advertising in local queer magazines, websites, things like that. And lastly, don't minimize our queerness. So, throughout dental school, something I heard multiple times by classmates, by friends was, "Oh, I didn't know you were gay because you don't look gay, you don't sound gay." And for a lot of people, they think that that's a compliment. That's not a compliment. That tells me that you don't see me as an entire person for who I am. That tells me that my queerness is something that's better left untalked about or unsaid. So don't minimize that. Don't be afraid of, if you have, a gay couple come into your clinic, don't be afraid of asking about their partner, about their kids, about their family, how they met. Treat them just like you would treat any other person in your office. So small changes you can make today. I'll kind of go through this quickly. I know I'm running a little bit of time. Talking about, when it comes to patient intake, design your health history form to be inclusive. Look for an EHR system that allows a different gender option rather than just male and female. Have a space for a patient's preferred name versus their legal name. Again, have other gender choices, right? Like have a non-binary choice, a gender non-conforming choice. Have just a blank space under gender. That will allow someone who may be non-binary, maybe trans, to feel comfortable at your office. A good idea is to also get a list of other healthcare providers, support systems that here in your community that work with the LGBTQ community. Or healthcare providers that work with a certain patient if it's someone that you want to really make feel included in your practice. Pronouns. This was something that I came across recently, right? The golden rule of treat others the way you want to be treated. But the platinum rule, I think I got this from Dr. Koch, is to treat others the way that they want to be treated, right? So using the pronouns, it's always okay to ask someone what someone's pronouns are. It's better to ask than to assume. So what does the dentist need to work, right? We need a complete medical history. We have a complete understanding of medications, surgeries, any diagnoses. But maybe more importantly, we need compassion, empathy. We need professionalism. We need ethics. Now, overall, we need that patient trust. We don't need to know what sort of genitals someone has. We don't need to know who someone goes to bed with that night, right? So there is a difference between really asking for the safety of the patient, for the inclusivity of that patient versus prodding, right? And that's something that will kind of come with time. But again, you want to treat any patient, no matter if they are gay, lesbian, transgender, or something that you might not even have heard of. They're human and they want to be treated just like you want to be treated. So questions that are okay to ask and promote inclusion. What are your pronouns? What name do you go by? Normal questions that you would ask other patients. Who do you live at home with? Do you have a partner? Who did you bring with you today? That kind of helps build that patient trust, build that rapport. Asking about involvement in the community as well. That can also be a gateway of how you can become involved in the community and be supportive as well. So changes at a larger scale. So there's still a lot of work to be done. We've had a lot of progress, specifically within the last 2, 3, 4 years. A lot of major changes and progress has been made with the queer community. But there's still work that we face. Incorporating queer education in dental schools is something that is still very needed and still lacking in most dental schools. Ensuring dental schools are affirming to all genders, all sexualities. Creating a diverse hiring board or admissions board with your organization. And then the grassroots work, really working with the LGBT community at large. This community has a huge disadvantage when it comes to healthcare because of different factors, but overall, really because of discrimination, because of fear, because of factors that affect these communities that prevent them to having the equal access to all healthcare, but specifically oral healthcare. So the grassroots work, working on the field with these communities, that is where the work that's needed. And that is it for today. Thank you. I'm going to transfer it back over to Dr. Kim.
Thank you, Dr. Barrera. Thank you so much for sharing your story and all the work you do. I encourage our participants, if they have the opportunity, to also check out the Houston Equality Dental Network. They have some really good programming, some of which I've had the opportunity to attend. And congratulations too, that it looks like you're going to be branching out into Austin and Dallas. That's awesome. Really great to hear. And I want to introduce our final 2 speakers. This is really special because we have one of our deans at Rutgers and one of the students. Miss Christina Accardo, she's a 3rd-year dental student at Rutgers. And Dr. Rosa Chaviano Moran is the Associate Dean for Admissions at Rutgers. She's also faculty in periodontics and community health. She's an advisor and a mentor. She was recognized by the chair of the American Dental Education Association and the Rutgers University Leaders in Faculty Diversity Committee for national leadership in holistic admissions, student advocacy, mentorship, and empowerment of underrepresented and marginalized groups. And without further ado, I'm going to turn it over to Dr. Moran and Ms. Accardo.
Thank you, Dr. Kim. Well, good evening. Thank you for joining us tonight as we discuss how to become effective allies for the LGBTQ communities we serve. I am privileged here tonight to be joined by Ms. Christina Accardo, Rutgers School of Dental Medicine, class of 2022, who will begin our presentation by sharing her story from the dental student's perspective.
Good afternoon, everybody. First, I want to say thank you to the ADA for hosting this event, and thank you, Dr. Chaviano, for including me in her presentation. So, my name is Christina. I grew up in Staten Island, New York, in a very conservative family where the LGBTQ community is very small and hidden in the background. My first exposure to it actually came from my peers in high school. Other than that, there was almost no representation or conversation about it. I think the reason for this is because people outside of the community don't openly express support or choose not to acknowledge the community as if it doesn't exist. This doesn't necessarily mean that they are against LGBTQ, as I have never experienced any hate or blatant denial, but it seems like most people would prefer to ignore it, especially if it doesn't pertain directly to their life. That's why this presentation today is so important, and Dr. Chaviano does a great job in explaining the power of being an ally, which Alex also spoke about, and thank you for that, Alex. I can speak for myself in saying the importance of inclusiveness, conversation, and acceptance from people outside of the community cannot be underestimated. So thank you today for having me, and thank you to all the other speakers and those who chose to listen today, because everyone has the power to make an impact. I'll now pass the attention over to Dr. Chaviano so she can begin her amazing presentation.
Thank you, Christina.
Thank
So as you can see, this is an important topic, especially in these times where most of us are focused on diversity and empowering historically underrepresented groups. But what we have to realize that the LGBTQ is another underrepresented group, especially in the dental profession. So how are we going to be recruiting and retaining LGBTQ students? What are those obstacles and challenges that our prospective students are facing? Why is it important for us to have an inclusive and thriving institutional environment for our students? And why is it so important to become an ally? We must realize that the millennial generation comprises the largest cohort applying to dental institutions and also entering the dental workforce. Our admissions processes must be inclusive of all students, regardless of gender, race, ethnicity, national origin, age, sexual orientation, gender identity, gender expression, or socioeconomic status. Our dental institutions must create welcoming, diverse, and equitable environments for all of their students, and also build sustainable pathways and mentoring programs, not to only recruit, but also to retain diverse students. And I like to use the words attract and thrive, because that's really when you're recruiting, you are attracting people to our programs, but it's not just attracting them and bringing them in. How are they going to flourish? How are they going to thrive and to make it through 4 very difficult years of dental school? We have to understand and realize that a diverse student body builds a diverse oral health workforce. Those are the next dentists, the next faculty, oral health professionals. And I want to be very clear when I speak about, I'm not speaking about just dentists, I'm speaking about the oral health workforce, all of us, the hygienists, the assistants, the dental therapists, all of us that are part of this workforce. And understand that the diverse workforce will increase access for and support a diverse patient population, which is also our aim. So we have to understand that. And how are we going to be creating this inclusive and thriving environment? We have to realize, and when we see the data, that in recent years, there has been an increase in the number of people who identify as LGBTQ. And this increase is mostly driven by the millennials. 8.1% of millennials identify as members of the LGBTQ community. 1.4 million of adults identify as transgender. So as academic programs, as academic institutions, we have the responsibility to create this awareness, to educate and train oral health care professionals on this very important topic. And this, I want to share with you, and Dr. Barrera did a great job, and Dr. Koch and Christina, on the obstacles and challenges that our students, that our workforce that our patients face. But when I'm trying to recruit and I see a young person who's considering becoming a dentist or any kind of oral health care profession, they see our profession as a very conservative profession. So, they worry about the system and policies, practices that we have in dental education and allied dental programs that do not support sexual orientation and also limit gender expression. The applicants that identify as LGBTQ express concern of unfair judgment and stereotyping during their admissions application and interview process in both dental education and allied dental programs. And as Dr. Barrera said, when applying to residency programs, this concern is magnified. I will tell you that we are so privileged at Rutgers to have these amazing students. I mean, I'm not going to say that we're perfect, but we really try so hard. And I will have dental students that get very involved with our clubs and in a lot of activities, and they become leaders. And then when they are applying to a pediatric program, they're applying to an ortho residency, and they say, Dr. Chaviano, would you write a letter of recommendation? And they don't want to put that. They don't want me to showcase the fact that they were leaders in the Dental Association for Equality at our school, because they are afraid that it's going to be a detriment to them. So this is very, very scary and very concerning. So we have to be very aware of that. And as an admissions officer, I must train my members. The officers that are part of all admissions committee have to be educated on cultural competence and biases. They have to learn to build a common understanding of what the desired mission-driven outcomes of our admissions processes are, as well as the criteria and processes in order to be able to achieve those outcomes. We have to value and evaluate each prospective candidate based on their experiences and their accomplishments and the road travel. That's what we have to focus on, not on whether male, female, that's irrelevant. That's when we talk about diversity, we have to bring everyone to the table. We have to highlight the institutional policies that our schools have in place, the curriculum, practices and programs that promote and ensure an inclusive and equitable environment. This is going to be critical in order to be able to attract those students that are going to have an amazing impact in your programs. And this slide, really, I just sort of wanted to send the foundation, because we need to have all of these things in place in order for our institutions to truly, not only just the institution, but us, in order to become allies. We need to be open-minded. We need to confront our own prejudices and biases. Don't assume, never assume the gender by the way one looks or expresses themselves. Do not assume the pronoun to use. We live in a society and a culture where many of our applicants may have gender neutral names. Again, do not assume the pronoun. Simply ask the person, how would you like to be addressed? Listen, be willing to talk. Believe that all people, regardless of gender identity or sexual orientation, should be treated with dignity and respect. Convey to the LGBTQ community members that they will be safe, that they will be understood, accepted, and able to thrive in your environment. Encourage them to feel open and comfortable being who they are. As allies, as healthcare professionals, we must value and know that diversity breeds educational excellence, not only educational excellence, institutional excellence. So we need to be very aware of that. And, I'm a fervent ally. I value and admire all of my amazing students. It's not just one group, it's all of them. My commitment is to them. I founded and became the faculty advisor for the Rutgers School of Dental Medicine Association for Equality in 2011 at the request of a student that opened my eyes to the need of creating and providing a welcoming and inclusive environment, not only for the students, but for the allies and for the faculty and for the staff. Of course, this is student driven, but that was our first step. I have to tell you that I was lucky enough, I'm blessed that this young man opened my eyes. And again, I don't want to say that we are perfect. We have many challenges and Christina knows that, but we work together. And one of the reasons I'll never forget when she came for her interview, and after she saw my presentation, she came to me, and I tell you, it was very, very rewarding as an educator for me to have that kind of connection with her. But again, dental programs continue to lag behind other health professions in providing information and lessons about LGBTQ issues that arise in healthcare and academia. And both Dr. Koch and Dr. Barrera has shared that with you. Many dental institutions still don't have student clubs where the LGBTQ students and allies can gather, where they can feel valued and included and share, that collegial environment that our profession should be nourishing. We need to create safe spaces for all of our students, regardless of sexual orientation, gender identity, or gender expression. So my recommendations, just like my colleagues before me, learn and or join an LGBTQ professional organizations. Stand up against homophobia. Integrate LGBTQ topics into your professional life. Pursue professional development in these topics. I will tell you, it will open your lives. It will be life-changing. And I want to close with this slide, which is very dear for me. I first want to thank all of you for your attention. I want to thank ADA for inviting me and Christina to present along with these colleagues like Drs. Barrera, Dr. Kim, and Dr. Koch. And this slide represents what ADA has been working on and continues to. This is actually in 2019. I was lucky to present with other colleagues, and in the interest of time, I'm not going to be mentioning a lot of names, but you can see that ADA is very focused on embracing diversity. ADA is very focused on amplifying voices. I specifically want to thank Susie Galvan for inviting us, because I know she reached out to me and she knows I get a little nervous on these presentations, but Christina and I said, we've got this, we can do this. So please, I encourage all of you to learn to become allies, to use this webinar as a launching pad to begin and provide the best support to the LGBTQ community. We need to remove the barriers and make a better educational and professional climate for all, for our prospective students, for our colleagues and our patients. And I want to recognize my son and his partner, Michael. I am so proud of you, and you have made me a better mom. So thank you all. This was amazing. Thank you, ADA.
Thank you, Dr. Chaviano and Ms. Accardo, for sharing this information and the work you do. as someone who's kind of removed from school, I don't think about school and residency so much, but that's really the entry point for so many dentists. So it's just really important that we make sure we're including our diverse colleagues at the stage. I want to thank all our panelists, Dr. Koch, Dr. Barrera, Dr. Chaviano, and Ms. Accardo. I really learned a lot, and I want to learn more. You've helped me realize some of the privilege that I possess, and I think many of our attendees will agree with that. And I hope the Q&A can teach us even more and bring more information on how we can be better practitioners and better allies to our colleagues and patients and families and friends.